Good morning everyone. For today's video, I will going to do a postpartum assessment. So I'm Joyce Trisha Vergara, student nurse from Bilian Province State University, and today I'll going to demonstrate postpartum assessment. The purpose of this assessment is to examine physiologic and psychological changes that occurs in mothers' bodies and mind. So I already finished washing my hands. So I'm now wearing gloves to perform the assessment. So before I'm going to perform the assessment, I will going to ask if the mother if the mother will going to agree. So today we will going to perform the bubble reassessment. The B, which is stand for breast. So we will going to do the assessment to the breast first. So before we open the mother's pool, we will going to ask for her permission if is it okay with her. So before we're going to do the assessment, we're going to ask first the postpartum patient, postpartum mothers, what she feels if her breast is fully loaded or heavy, and we will going to assure her that that is normal because she is in a postpartum period. So now let's proceed to the assessment. While we're going to expose the breast of the patient. So there are three types of nipple, which is inverted, and the flat one. So we will going to check the areola. So let's check if her areola have cracks, lesions, and any. So far, as I can see, the patient don't have any wrong when it comes in terms of her areola, and we will going to assure her that it is okay to breastfeed as long as the infant will not get affected. So now I will going to feel the mother's breast using my palm. If her breast is normal, if it is cold or warm. So now we will going to proceed to the uterus. First, we will going to lay the mother in a supine position. Make sure that the mother is in flat so that we can do the assessment correctly. So we will going to ask for the mother's privacy first, as we will going to expose her abdomen. So I'm going to detect her fundus. So I'm going to use both of my hands. I'm going to put my other hand in the uterus. Then so since the mother is delivered today, the fundus should be in the middle, in the middle. So describing the fundus have three types, which is film with massage in the body. On film with massage, it depends on woman's body. If the woman is skinny, then expect that her fundus is hard like rock. But mostly the woman is usually the woman's fundus is like a tennis ball. While in firm massage is that if you will going to squish it or rub your hand in the fundus is that, and you will see that it is firm, and you will detect if it is firm, then it is firm massage. While the body is that whatever you do, even though if you will going to rub it or massage it, it will not be firm. That is very bad because it indicates hemorrhage to the mother. To conclude, if ever you will going to describe the mother's fundus, make sure that you will not going to touch her abdomen everywhere. Make it quick as much as possible. Make it painless as much as possible because it is very painful to her, especially if the mother is in C-section. So now let's proceed to the next B, which is bladder. So first, we need to ask the patient if when did she last void, and if she will reply that she will not feel to, then encourage or educate her to void every 2 to 3 hours because she is in a postpartum period wherein she will not going to feel like going to the comfort room. Then, educate her that if she will going to avoid every 2 to 3 hours, she will going to benefit a lot. Like for example, it will help her to fast recovery, fast healing, and feeling the pain less. So now let's auscultate the mother's abdomen. 4 sides. So, moving on to the next bubble heat, there's no reason why postpartum woman who delivered a normal vaginal delivery would have a normal bowel sounds. Spinals do not affect their bowel sound, but a woman goes cesarean section could be possibly affect her bowel sound during recovery. Next is ask patient when was the last time she ate or drink. Most women don't realize after the baby is born they could eat anything because they needed food to breastfeed for the baby. So now let's proceed to L, which is lochia. So we're going to expose the mother. We're going to check her pad. Then we will going to ask the mother when was the last time she changed her pad. Then if she will reply that he just changed it a while ago, then encourage her to change her pad every 2 to 3 hours if ever she will going to void, because and tell her that changing pads will going to avoid infection because postpartum mother is prone on every infection. There are 3 patterns of lochia. The first one is lochia rubra, that is with after the delivery of the postpartum mother. The next one is lochia serosa, which is the brownish blood. The third one is the lochia alba, which is the yellowish blood. So now let's move on to E, which is episiotomy. It's not common to do episiotomy, but in the same moment with laceration, we need to assess that. Let's look for the redness, the bruising, the edema, the discharge, and the approximation. P.S. There should never be discharge or drainage. So now let's move to human sign. We will going to expose the patient's legs. We will going to support her legs using my hand. We're going to, if the patient will going to use force, tell her to relax. Then I will going to dorsiflex her calf. Then ask for if ever she feels pain. Then if she say yes, then it is a positive common sign. So maybe there is DVT there. Then we're going to assess her calf. Then see if there is any redness, swelling, and heat. And do check penopulses. There should be 2 normal if they are absent already, then it is abnormal. Then do to the other legs. Going to put my hand here, then dorsiflex. Then check for the redness, swelling. So now let's proceed to the emotional. So make sure to ask the mother if she is okay as she do after she delivered the baby. Ask her if she is exhausted, in pain, and look for the person or around her. Don't make her and make sure that she is not alone. Make sure that she have a support system, which is her family, her husband, and also check if after she give birth that she have a care to the baby, because most women they don't really care about the baby. They will just going to leave the baby there and go and use gadgets, and also make sure that the mother already accept that she already have a baby. So now I will going to document the findings. So next, we will going to do the thereafter care.